It's a revolving door. Public health departments across Indiana and the country struggling to keep workers. News 8's Adam Pinsker joining us now live in studio. Adam, is this a COVID issue?
You know, COVID is partially to blame, but there's other factors as well. You can combine that with retirements, burnout, and low pay. That equals a lot of turnover. Public health workers do a lot more than just give vaccinations. There is a major void developing of skilled public health workers. According to a survey by Governing.com, nearly half of state and local healthcare workers left their position between 2017 and 2021. That number increased for workers under the age of 35.
Unfortunately, the jobs just are not high-paying jobs. Sometimes they require a public health degree, sometimes they do not. And so we're just running into an issue with trying to recruit people into those jobs.
Director for Public Practice at the Fairbanks School of Public Health, Shandy Dirth, says public health workers are finding higher paying jobs in the private sector. Inconsistent funding is another problem. Health departments are often given an infusion of federal funds after a public health crisis, but those dollars eventually dry up. The CDC is awarding grants to help local health departments build up infrastructure, but that only benefits larger departments.
Our other health departments are missing out on that direct funding. The state does have a plan to try and help some of the local health departments.
Dirth says for several years, Indiana has ranked far below other states in per capita funding for public health. She says public health workers are the ones who inspect grocery stores and restaurants. They also test air and water quality after major events like the big fire in Richmond last week.
Childhood immunizations, summer's coming up soon. We have those back-to-school clinics happening with local health departments to make sure the kids are fully vaccinated. Measles, mumps, rubella, not just COVID. Health departments do lots of things outside of COVID.
And Shandy Dirth says that she's hoping the legislature will pass Senate Bill 4, which, among many other things, allows local health departments to enter into contracts or approve grants for core health services. Adam Pinsker, Wish TV, wishtv.com, and like us on Facebook.